The Houston government has released its latest provincial budget, which continues with massive spending on health care and some help for some people feeling cost of living pressures. Alan McMaster, Nova Scotia's Minister of Finance, is with us now. Welcome.
Well, thank you. Nice to be here.
I heard you say that Nova Scotians wanted tax relief, and they're going to be getting that in the indexed tax brackets and in basic personal amount. It's between $269 a person. Doesn't sound like a lot of money. How much relief really is that?
It'll start coming for people in January of 2025. They'll notice it on their paycheck. There'll be less money coming off, more going into their pocket. And this is the kind of tax relief that's going to get bigger and bigger every year. So it's going to compound every year as it's indexed. It'll become worth more and more to people. So it is a big decision point. It's something people asked for. It was the number one ask in budget consultations, and we were able to provide it.
Why not take a couple points off the HST? You know, if people want tax relief and they want a lot of more money in their pocket, wouldn't that be a better way to do it?
Well, income tax is something that, you know, anybody that has to pay income tax, they're all paying it. Consumption taxes like HST, certainly people need to buy a certain amount of things, but once you get past that, people who have more money can buy probably it's unlimited how much they could buy and could benefit from an HST cut. We felt the income tax relief was something that was better for everybody, and it was also the number one thing that people asked for, was to actually index the income tax brackets. But we went a step further. We indexed the basic personal amount, and we also indexed various tax credits. All told, it'll mean more tax relief.
Talking about people who are affording things, there's a lot of people in this province who can afford a lot less. And yet your government has not increased the income allowance for the third budget now. Why not? Surely there must be more that needs to be done there.
Well, we actually did increase it by $300 more per month for 60% of people who are on income assistance.
This was just recently?
Yes, it's actually part of this budget.
Mm-hmm.
And so there's a significant increase, and I understand that will be anywhere from a 22 to 44% increase for people who have disabilities. And
that's just people with disabilities, though.
Yes.
So I'm talking about everyone who's on income allowance. Your budget hasn't increased that for everyone.
Well, there are supports throughout the budget, and every ministry has a role to play. One of the other significant things we announced today was a school lunch program. So anybody that is having difficulty making ends meet at home and sending their children to school, a school lunch program combined with a breakfast program will ensure that some of that pressure to provide food for their children going to school, some of that pressure comes off them at home.
That would help. I could see that helping a family, but that's not going to be fully rolled out for 4 years. Why is it taking so long to get what should be a fairly simple program out and running?
Every school is different in the province, and we have, for instance, there are some schools that are primary to 5, some are primary to 8. Schools have different food preparation equipment in them. So there's all these details we need to work out, but I know there's work happening on it already. There's a real interest, to be fair, about which schools get it first, and we want to start with the youngest grades first. So I know people at the Department of Education are going to be, they're working on it now, and there'll be a lot of work happen over the summer. And once people come back for school in September, there'll be some efforts then, because teachers will be involved in this, and everybody will need to get familiar and set up. And our hope is by the fall, this program will be up and running. And the first part is in the budget today, about $18 million. And then as time goes on and it's expanded to other schools and other grades, it will grow in cost, but it will also grow in benefit.
Mm-hmm. A lot of desperate people will be looking at this budget and saying, I want more in public housing. They're not going to get it in this budget. Why not?
Well, they are going to get it because we've increased, in just 2.5 years, we've increased the number of rent supplements from 4,000 across the province to 8,500 in this budget. So we've more than doubled the number of rent supplements. That helps people who can identify housing, which may be a bit out of their reach. The supplement can help bring it within their reach.
I'm talking about building public housing, which is what all the experts are saying we
Yes.
need to do more of.
Well, we're trying to leverage the private sector. As you will know, we took the the provincial sales tax off the construction of multi-unit residential housing. So that is an incentive for the private sector. But if there's not enough happening through the private sector and through cooperative organizations that also build housing, we've taken the step to, in this budget, to build more public housing. And that's the first time in a long time that the province is investing in new public housing. It's more expensive to own, operate, maintain. We have the stats to prove that, but we're willing to accept that we need to do it.
I need to ask you about the healthcare spending because it's massive in this budget as well. It's a big dollar figure attached to it. Does it come with any guarantees or confidence that you are going to move the needle on wait times and wait lists in this province?
I think we've been moving the needle already. In fact, if you look at long-term care beds, nursing home beds, when we came to office 2.5 years ago, there were 500 vacant beds because there was no nursing staff to have people in those beds. Those beds are all full now. Over 300 more have been added to the system. They're full. There's a significant decrease in surgery wait lists.
They're still some of the highest in the country, though.
Yes, and that is because we had a system that was not capable to handle the population we had, let alone the population we have now. So we're very interested in results. We want to be able to point to results, and in this budget, we are building on the results we've gotten so far, and we're hoping to achieve more.
So many lines in the budget. We only have so much time. I appreciate you talking to us about it.
Thank you, Tom.